So hello everyone and welcome to another AMA here at Crypto Miners. My name is Mary and today we have a very interesting project with us called IVIRSE. And from IVIRSE we have Max, the CMO,
Hello,
and
guys.
Leo, CTO. Very welcome guys, happy to have you here. Nice. So please start by introducing yourself a little bit. Who are you? How long have you been into crypto and so on?
After you, Leo.
Okay, so my name is Leo, and I am the CTO of IVIRSE. And so I was working with I have been working with blockchain since 2018. At that time, just a few people knows about the blockchains, and most of people just maybe interested in some aspect of the cryptocurrency. However, I found very maybe have the potentials in the blockchain to become it can be applicable for a lot of the applications in the real world. So I start to build some kind of the applications for the healthcare system from since that time. So for now, I have maybe 4 years of experience in designing about the blockchain system, and for now, I'm working for IVIRSE as the healthcare project in the blockchain. So I think that today I can bring for you some kind of the useful information about our project, and I hope that I can maybe receive some kind of feedbacks from you customers and users, maybe potential users in the future, because that any comments or feedback from you are very valuable for us to improve, and maybe your idea also valuable for us to build our system, because our system will be bring for use. So bear in mind that all of your ideas is important for us, and yeah, I will welcome any questions you have. Thank you.
Guys, this
Nice.
is Leo,
Thank you.
the CTO of projects, and he's a lead dev. So any feature that you want to see or you want to see in IVIRSE, just raise your question. Anyway, my name is Max, and I'm in charge of the community for IVIRSE. I have been in crypto since this third wave of Bitcoin, I believe 2015, 2016. I got several lessons, and then I have been going there, and I have been wandering in this world until I finally catch up with IVIRSE. A very profound, a very, very interesting, but a very platform project that it promised with user, with investor, with stakeholder, lots of potentials. And just okay, Mary, could we move on?
Yeah, sorry, my laptop just died. Typical. So, yeah, can you please just tell us a little bit about the project then, an overview, very shortly. What is the project about? IVIRSE.
So, IVIRSE is the metaverse in healthcare. We have an ecosystem, and we want to build and to have the users of IVIRSE to explore the universal healthcare that really customer, really data, really customer centric, and it's the experience in the inner of our ecosystem, the product that will bring the benefit, that will bring the prosperity for you to hold the token, to use the token, to use the product within the ecosystem. So IVIRSE is about digital health, about healthcare, about universal healthcare, about metaverse in healthcare.
Okay, that sounds like a very vast field, healthcare. So, so what aspects and problems does IVIRSE currently support and benefit in the healthcare industry?
Okay, so the use case that we are looking at is to solve. We have an ecosystem of many products that ranging from very distinct pillar of the healthcare system, the doctors, the healthcare facilities, the users, the patient, the pharmacists, the medicine makers, the health research organization. They both using the product of IVIRSE. And what we are aiming and what we are trying to solve is the integrity of data using the blockchain technologies, the cutting edge technologies to solve the integrity of the data. So, for example, I will take COVID-19 as examples. During the pandemic, we know that it has taken a lot of time for the researchers, for the contract research organization, for the pharmacists, for the pharmaceutical company to test and to involve with the product and to produce, to do the clinical trials and so on to produce the vaccine. But the problem is the data is not available. Is different from every single facility healthcare. It's different from people. That people are not talking in one way. So using blockchain technology, IVIRSE can solve the data integrity of the system, and seeing that we promote a precise healthcare solution for everyone.
So the integrity of the patients will be kept better secret with blockchain, you mean? Or?
Exactly.
And that is why you use blockchain technology only, or is there other benefits?
So let me answer these questions. So so the first problem we want to solve is that you can see that in here, in like the traditional system, like it will pose a threat of some kind of the singular failure. It means that if you have only one server or one maybe system which can control every actions in your system, and it will be very vulnerable for the attacks. However, with the blockchains, we have the decentralized system. It means that we can eliminate some kind of the maybe we can eliminate the singular failure for our system. And you can see that one very important factors in the medical data is that medical data is very sensitive for the people. For example, like you don't want to solve or you don't want to review your personal information about the what disease you have, what maybe some kind of the medical history or something like that with other people, right? So in that case, well, by using the blockchain, we will eliminate the attack and we can keep the security. So in that case, we also have the second questions like how can we keep the secret? I mean, keep the privacy for our customer, our user. So it means when we use the blockchain system, you can see that all the actions will be in terms of some kind of the transactions, and you just to reveal to the world about the public key. It means that is the string, and with the some kind of the characters and the numbers. You don't need to review your personal informations. And so in that way, you also can share your informations, but I mean the medical informations, and you don't reveal your personal informations. It means that you just show the data you want to share, and you can keep secret for other informations. And so in here, the things we want to do with the blockchains, we want to do something like the fully decentralized system. It means that we will decentralize the data. For now, for example, like the NFT or something like the data in some kind of blockchain system, they're using some. You need to push the data into the server of the maybe some administrator or something like the company who own the blockchain system. However, we aim to solve this by using the fully decentralized system. It means that data will lie in your devices. For example, like the laptop, the mobile, or something like. For example, like if you have the images for any part of your body from X-ray or something like images from hospital, you can keep it in your devices, and we can do something like we can certify or can validate that it belongs to you, and you don't need to review the information. And we also can maybe make use of your data to change our model in terms of some kind, create some kind of the artificial intelligence in the future. And you can see that if we have a lot of data from a lot of people, we can build very powerful artificial applications, and it will be used for all the people in the system. For example, like given an image about the X-ray, for example, for your lungs, and we can predict about do you get a COVID or not. And maybe another application is like if we can collect a lot of data around the world, we can even predict about the pandemic. For example, like if you see any kind of the disease, and the cases about the disease will increase over time, like the COVID-19, you can see in the Wuhan in China, if the number of cases is increased maybe exponentially, and we can predict that it can become the pandemic in the future, and then we have the treatment and we could have the methods to prevent it before it spread all over the world. So that's why we want to build the blockchain system. Yes, and the key factors in here is to keep the data secret into the devices of the client, of the users. However, we can make use of that and validate that you have your data or not. And furthermore, you can see that for the people, we always want to share the data, and we want to contribute to community to build some kind of the useful applications. And you know that your value, your data is very, very valuable. And because like it can be used, and because it's valuable, so we use it in the we will convert your data to become some kind of the NFT. And so in what is the NFT mean? NFT is just the non-fungible tokens. However, we just do only one thing, is that we will validate your data and certify that that data belong to you, and you can use your data for trading, and it means that you can earn your money from our system. And a lot of jobs will be created from our system, like for the doctors, they can use our system for validating the images from patients, and the patients can share, can sell your data, their data to other people. And some kind of companies about the artificial intelligence, they can buy the data from you to make some kind of the applications for other people. Yeah, so a lot of work, a lot of potential for our system in here, and that is the reason why we use the blockchain.
So do you mean as a patient then you have access to your own data, and you have control over it yourself?
Yeah, that's right.
Blockchain.
Yes.
Okay.
We do. Yeah, we aim to fully decentralize it. It means that we will give the maybe the ownership in the pocket of the clients and user, instead of governed by ourselves. Yeah, we just create an automated. We just create an automated governance system, and then we'll give it to the community, and all the things will be will be operated by the user. Yeah.
Yeah, and you have security, you said also, like, so your system is secure. So me as a patient, I can feel secure if I put my data in there.
Yeah, that's why, because like
Can't be.
no one want to some kind of the share information, especially for the medical history for other one, right? For some kind
But
of the
how,
very
where I understand that the technology, the blockchain and everything is very good for this kind of purpose, but where does the token come in? Because you have a token as well.
yes.
When does that come into use?
Yeah, that is very, very good question. So so for the token, is this something like the reward? Firstly, it is the reward for you when you do the transactions by using the IVIRSE, because the IVIRSE is the ecosystem of applications, right, for the healthcare. So it means that whenever you use the application inside the IVIRSE, and for example, you spend some coin to buy some kind of the medical or healthcare services, and then you will be rewarded. And in that case, the coin like the IV or IHI will be created, and it will be granted to the user. So that is one way. Another way to earn the coin is like you can place in a role of investor in our system. That is similar to some kind of stock, and we will sell it. And because like you invest to IV and IHI, right? The IVIRSE ecosystem, and then you can get the IVIRSE based on your money you invest to our project. And so
So
another case is
your profit from this because you're a company, you're a proper company already, right?
yes.
Mm-hmm. And so incorporated, and the profit, some of the profit will go back to the holders of the token. Is that correct?
Yes.
So let me clarify
Okay,
this, Leo. We have IV as a trading token, and the total supply about 800,808. It's a 9 number of 8, and unit
nice.
that has been is prosperity in Southeast Asia and in the Asian belief. And the use case is you can use to purchase the healthcare, the digital healthcare service that we already have on our platform. That we have an application and technologies for purchasing or doing the digital health session with the doctors, or you can purchase the medicine, or you can purchase the package of supplement on this application and this platform, and it can generate token for you. And Leo said another use case is you can use IV for your economic purpose. For example, you making purchase, you investing, you buy the token, just like the other security. And we are looking for a long-term investor who are believing in the platform, in the ecosystem, and who is going to go with us in the long terms, because healthcare is the futures and metaverse. Healthcare is always a difficult, always a mathematic that we always want to solve, and metaverse is the technologies of the futures, and combining this we have IVIRSE, and this technology, this project is prospect, and we want to looking for the promising token holders to go with us in the long term. And on the other hand, we have IHI, which will act as a stable token, and it will be pegged on an unit, and this is going to buy, is also using to be buy and to sell the healthcare service, or to be rewarded for the user in the IVIRSE ecosystem. And I have mentioned in earlier, we have pharmacy management system. We have application, iSoftcare, the application that you can download and you can have a conversation with a professional licensed doctors
So
online.
that is already out? That's already available?
Exactly.
Okay.
Exactly.
Nice.
Yeah.
So how do you are turning, or I mean, you can you target all of the people in the whole wide world, or some different areas you start with, or how will you do this?
Yes, we are global projects, and we have targeted these users in developed country who are really interested in solving the world problem, for example, hunger, the healthcare, the promotion of access to health, the promotion of reduced poverty, and so on and so on, as a sustainable development goal. And we're targeting the user in those countries because we have in the crypto world there are the trading the surfers, and you know that people just going to buy the token and then dump the token as soon as they get the profit. And we are not looking to have the user in the projects because we want to view a very prospect for our token
more long
holder.
term.
Yes, exactly.
So
Okay.
when did you start growing this? When did it start?
It has always been start, but it has just recently been it had always been started since 2015, but it has only go on blockchain and go on the metaverse since last years.
That's interesting information. You are a real proper company who already had customers all over the world.
Exactly.
And now you're going into the blockchain.
Yes.
To more security then. Is that the reason, because of the security aspect, or why did you choose to go on the blockchain?
Yes, as Leo said, a blockchain is serving for the security problem, the data integrity of the people, and it also work as it's also remove all the boundary that having in the real world. So metaverse in healthcare can enhance the medical treatment, helping the healthcare professionals in various areas, just as it is right now enhancing the e-commerce industry. I mean, at least not now, but in the near future. For example, you can imagine metaverse in healthcare can take charge of the frontline healthcare worker, having them to save lives without putting themselves in danger. For example, surgical operation with VR. Those are very prospective application that it can be enhanced, it can be developed in the future, right, Leo?
Yes. So another things I want to maybe get clear is that we the reason why we convert all our system into the blockchain is that, so you can as I said before, like the medical data is very sensitive data, and the real thing is like no countries, no nations want to reveal about the real data for the healthcare or the medical data. For example, like in the China, they didn't for example, some countries in the world, they didn't show exactly the number of deaths in the COVID-19 because it will affect to our maybe some kind of the economies or something, like for the under industry or something like that. It affect on the nations. However, sometimes we need to know that we need to know an exact numbers. We want to know the exact medical data, because with that data we can predict about the maybe the level of dangers for a pandemic or something like that. It is very sensitive for the nations, however important to people in the world. So with the blockchains, we can record the exact information, especially for medical data. And because it is sensitive, so that is the reason why we need to keep it in secret. But we have to have the precise data. So that is the reason why we convert our system into the blockchains, and we think that in the future, all the people need to have the transparent data. It means that we can trust other people, we can trust other nations, we can trust other countries, we can trust other people all around the world. And with blockchain, we can do it. We can believe in other people.
Yeah, so for the statistics, I mean, also to get the real numbers. It's, yeah, very interesting. So,
well, there are potential buyer. Well, Leo is talking about the technologies. When I'm talking about business, is that you want to do, for example, a lot of people here in marketing, right? And if you want to do marketing and in this era, you want to do very, very customized marketing strategy, right? And what do you need? You need data. You need to know exactly who this is, or there won't be a machine, there will be an AI to learn and to deliver your message to the right people. Of course, there is compliance for legal in terms of selling medicine, selling product. I'm not promoting any of those. I'm just really using the case of the buyer and the sellers, and about blockchain and how the business will be done to prove that this project is backed by a very, very strong business models, and we are not just creating IVIRSE projects in Cloud9 without nothing.
That sounds very reassuring. Very nice. So, how are you now going with the project to get more users? How many users do you have already of this application, for instance, or how much customers do you have?
So if we're talking about the application and the real use case that haven't been going through the blockchain service, we have 60 million users that have been using our real life platform. But this blockchain project is going to convert, is going to building the application for those users in real life.
Nice. We have some questions here from the audience, from the Twitter space I would like to ask. And also, I know you wanted to speak a little bit about the airdrop from IVIRSE. It has been taking place for a while, and maybe you can tell us a little bit about that.
Okay, so we just have the first airdrop to the communities, and we have rewarded the first 100 first people, lucky winners, to do the social activity, to do the social task, to spread to the word about this IVIRSE project. And for those who are winning our airdrop, they will get $30 in terms of token, certification, and it will be vesting after the IDO. And there will be a lot more IDO there will be a lot more airdrop in the next month, very few months, because we are developing our community. We want to get people who know about this project, who want to invest in healthcare and spread the word about this project.
So
even
to be eligible for the airdrop, you have to do some tasks. It's like a contest, or
exactly. So to do the airdrop, you will enjoy Gleam.io. It is the platform for you to get the airdrop, and then you perform several tasks. Very easy task, very minimum effort tasks. And then you will be submitting your ERC20 wallet on the Gleam platform, and then we'll select the winner, and then we will announce it on our channels and on own marketing channel.
So it's in Ethereum blockchain you're on.
Yes, ERC20 is working about the Ethereum network.
Exactly. And but those who didn't get any airdrop now or can't, can you buy the token already? Is it out to buy also, or?
Yes, you can buy the airdrop as soon as the IDO is launching, the IDO event, and we are right now going to launch the IDO very soon in late autumns, and then please stay tuned for all the information, and you will know about this.
Nice. So you didn't launch yet. Did you have a private sale or a pre-sale, or will you have maybe?
Yeah, it's been sold out in the private sale and in the pre-sales. You know, there's a huge interest in the private sale and the pre-sale section. Yeah.
So did you finish that already, or can people in here still participate in pre-sales?
Well, I would ask Leo, and if he have any more reserve and he want to share with the crypto miners communities.
Yes. So you means the some kind of the maybe some user want to buy some kind of the altcoins before IDO, right?
Token. You mean?
Yeah, token. Can I buy the token from you, Leo?
So because my team is working on it, so we will release maybe in the next 2 or 3 months with a lot of the applications go along with it. So that's why we want to maybe for now I think that we have the maybe portions for the maybe investor from community, so you can buy directly after maybe in the next 2 months. I'm not sure about the schedule. However, I am sure that we have the portions for the investor from community. So don't worry about that. You always have chance to join with us. Yeah.
Nice. So are you going only to be on Ethereum or also on other blockchains?
Firstly, we will deploy our ecosystem based on the Ethereum and the Binance Smart Chain, and after that, we will expand our community to maybe Solana or that and other blockchains. So
But Binance also, you mean Binance and Ethereum you can use to buy your token then?
Yeah, so firstly, you can maybe when it IDO, I think that we will list our coin on the Binance first, and then in the Ethereum.
Okay.
We are processing the paperwork and doing the due diligence with the Binance team, and I think you will find our token very soon after as soon as the IDO start.
Yeah,
so you mean you're going on the exchange Binance right away?
Yeah, we are processing the due diligence and then the paperwork with the Binance administration board.
Wow, nice. Very interesting. Okay, are you ready for some questions from the audience here now?
I have one more question. for you, Mary.
Okay.
Yeah, would you be willing to be buy token and then doing a partnership with us on IVIRSE?
Me? Yeah, sure.
Yeah.
I'll buy your token. I'll buy a token. And the partnership, you have to ask Alpha about it. It's his room, you know.
I see.
Anyway, the first question from the Twitter audience is the healthcare industry and blockchain technology suitable to work together for now? How does IVIRSE intend to combine these two sectors, and what innovations does it plan to make in this field?
Well, I would say that what we are trying to solve, can you repeat the
Yeah, I think he wants to know how it goes together to be on the blockchain and blockchain and healthcare industry and blockchain technology is suitable to work together for now. How does IVIRSE intend to combine these two sectors?
Yeah, so let me answer this question. So for now, when we mentioned about the healthcare industry, it's like the healthcare industry is very huge, and it have a bunch of applications in the healthcare industry. So for now, the most interesting things from healthcare industry is that we want to bring some kind of the services to patients based on the blockchain. And so you can think as we will do the things like we will be the connectors or something like the validator for you, and with our system you can connect with other doctors, with other patients, and also with other hospital. And so in the future, if we have the metaverse or something like that, so the blockchain will play in the role of like the validators. For example, like the blockchain will be the door, and if you want to go into the maybe the world of the metaverse, you need to maybe have the key, and the blockchain, your private key and public key will be the key for the door, and when you open it, and you can maybe go into the metaverse world. And so you can think that the blockchain as the validator. The blockchain will verify that is that you or not, and then provide the exact information to you and connect you to other services in the healthcare industry. Yeah, that's it.
Well, to be more precise, and to get you visualize much more better. For example, mental health problem. The mental health expert have already leveraging the augmented reality (AR) or the virtual reality (VR) or the mixed realities by putting their patient with the VR device to treat their patient better. So in term of in metaverse, and did have really useful use case because you can access to this service from any part of the world that you can choose a very very good mental health expert, and then it can be done with the AR and the VR technology, as Leo said. So the key here is IVIRSE.
That's nice. So you go into the IVIRSE with your avatar and show yourself to the doctor, you mean? That's the future, guys. It's the future.
Okay. And yeah,
it's interesting. So another question is, I read about IVIRSE DigiHealth NFT as an innovative solution to package, share, and monetize data with patients in complete control over every action. But I'm still curious, what is the use of this NFT in real life? Did you understand the question?
Yes.
Mm-hmm.
Can you hear me?
Yes.
Okay, so in fact, the huge data from medical, I means the diverse type of the medical data we need to converge into NFT. However, because like it is different in size and in types, for example, such as the images, the text, the script, and so in that case, we want to initially we want to digitalize the data. However, for now, we want just do something like the validator, and we will keep maybe some kind of the NFT is like we will store the data will be in your pocket, and we will be the validators, and use the validator to certify to verify that that data belongs to you or not. And in that case, we can use the data. For example, like another one, they have the very similar data like you, and they claim that that data belongs to them. However, they by using the IVIRSE, our system knows that that data is belong to you, and in that case, you can maybe provide the ownership of your data. And so in the NFT is just the data, and so we keep the maybe validator in our system. And so you can think that NFT is just the images or any type data we have, we can. However, the things we do here is the like we will do the verification step for your data before we use it. And in that case, we can keep a lot of the informations in the blockchain, and we also can keep the maybe the ownership of any maybe users in our system. Yeah.
Yeah, it's very interesting. I like this project. Very good. One more question is IVIRSE, IVIIHI is a biomedical project. I would like to ask if the technology of IVIRSE, IVIIHI can contribute to the fight against pandemics such as COVID, which needs an urgent attention. Is there a chance testing will be easier and faster in this IVIRSE technology?
Yes. So I think that this is very good questions, and I also mentioned before. We may have some kind of application related to the pandemic or something like that. The first thing is like we can utilize the statistic inside the blockchain, and in the future, maybe in the near future, in the next year, because like we will release and we will IDO the tokens in at the end of the year, at the end of this year. And then next year, we will release some kind of the machine learning algorithms. And in that case, we can make some kind of predictions based on the data of the people inside the network. I mean the blockchain network. And in that case, we can create a lot of the machine learning and artificial intelligence for a bunch of the applications. And in that case, I think that it will be very useful for the pandemic like the COVID-19. And so you can see that one thing you can do in our system in here is like IVIRSE is the ecosystem with a lot of applications, right? And so in that case, for example, when you want to use the IVIRSE to find the maybe reliable doctors who have the high rating, and because like we will store all the actions of the prescriptions of not only for the user but also the doctors and the hospital, so you can rely on the rating of the hospital and the doctors, and you can choose the most reliable doctors for you. And so in the near future, we have the AR and VR, right? And we use the blockchains like the mapping technology between the real world and the virtual world, like the metaverse. And in that case, only the doctor can diagnose and also can make the prescriptions for you remotely. And so, for example, like if you have some kind of the severe symptoms, and the doctors can remotely give you the treatment. And so that is the one of the applications we want to solve in the future, maybe in the near future, in the next year. We will start with the application like that. So I think that it will be useful, and I hope that we can bring the benefits for the community in the near future.
Yeah, very nice. So is there anything more you would like to say before we open up for questions from the audience in here, the live people who have been listening?
No, all good for me.
Okay. Let's go, people. Raise your hand if you have a question to the team of IVIRSE. It's a very interesting project. Let's see. Who do we have here? Oh, Telegram. Martin, I unmuted you earlier. I will unmute you again. Do you have a question for the
thank
team?
you, Mary. Thank you for the opportunity.
Let's go.
Yeah, so my question is about your O2O online to offline clinic. You said it helps patients keep the waiting room by instantly connecting with licensed doctors for medical care anytime from the comfort of their home, which means it is a 24-hour service. But I would like you to verify that claim. The reason is because, most doctors we have are always busy or unavailable. So how many doctors is IVIRSE planning to make available per day to attend to patients? Or is it that there will be an automated AI to answer patients?
So we currently have about 2,000 doctors, 200 active monthly. Weekly, and 400 active monthly. And of course, that doctor work on office hour, but there are also doctor on shift. And for example, the doctor, if they are working on shift and they turn their phone on and they are active, which means you can connect it with them. If you can connect it with them, it will come back and select another doctors, or we get a ping, and then we have a 24/7 team to manage and support if there is an emergency.
Okay,
Online
what if like an emergency happens in the middle of the night? How will IVIRSE attend to this?
Of course, if it in the emergency, and we are not a healthcare organization, we are a platform. So in any case of emergency, you must see and you must go to the nearest healthcare facility. Of course, you cannot just be in emergency and then you talking with a doctor online. It cannot get an emergency response. So in any kind of emergency, and you
call
are
the
getting
ambulance, Martin.
Yes,
call the ambulance.
Go to the nearest hospitals.
Yeah.
Yes.
All right, noted. You said it's a 24-hour service anyway. Thank you for answering my questions. Thank you, Mary.
Thank you, Martin. Thank you. Let's see. We have Mikasa Ackerman. Do you have a question, Mikasa?
Hey, Mary. Great project, Max. My question is actually just one and direct. I want to talk about your NFTs that are used to record medical data. Now, in cases of rare and high-end diseases that are cured, and this data is recorded with the NFTs, if another hospital is requesting these NFTs, who owns the NFT? Is it at the person's discretion to own the NFT, or is to release this NFT, or the hospital? Aside from the fact that there will also be medical records. Would the person be able to sell these NFTs to the hospital, or based on in-demand requests, give the hospital the NFT?
Speak too fast. Leo, can
So
you?
yes. So for your questions, like as I mentioned, we will put the NFTs. The ownership of NFTs is the customer, and for example, like you can have the prescriptions from hospital or doctors, and for example, another example, like you got something like you have the images, maybe the X-ray images about your lungs and any parts of your body, and you just need to keep like you need to get the some maybe verifications from the hospital or the clinic, from the clinics, and about your images, and also you put your images into our system like the IVIRSE, and then we will have to do another step, like we will use maybe we will add some kind of validator to validate your images. Is that the image have the COVID-19 or not, for example, just to validate and also verify about the maybe some kind of the papers you have related to the images. And in that case, after validated, the data is belong to you, and of course it's original belong to you. And so yeah, the data is for the user, and you own your data. Yeah.
All right, I'll be asking the rest of the questions in your Telegram group. I really appreciate your honest answer. Thanks a lot, Mary.
Thank you.
Oh, sorry. Lee, do you have a question?
Hi, yeah, just regarding the existing amount of users that you have on your platform. I heard you say earlier that you've got around 60 million current users of your system worldwide, which is an outstanding amount of people, and also data. So is that data going to be uploaded to the blockchain and therefore be secure, or will it just be new users that come on board, obviously, when this launches?
So as thanking firstly, many thanks for your questions. I think that is very interesting question. So so you can see that if we put everything in the blockchain, that is very, maybe we don't have enough space in the blockchain, and it will make our system become quite heavy. So that's why we leave the data inside. Can you hear me?
Yeah, I can hear you, Max.
Yes. So
Yes, we
so yes. I think so for your questions, I can we can think as this: if we put your data, if we put any kind of data into the blockchain system, we don't have enough space in the blockchain to do it, and it will make our system become very heavy. And so the things we are doing now is we put the data in the space of the user. It means that we will put the data in the space of user, maybe computers and other devices. And so we are also building some kind of the decentralized maybe server. And in that case, if you want to push your data into the server, and we also have the storage for you, and your data is completely stored distributedly in our distributed system, because like we want to do something like we create the hardware for it first, and then we build from it. We not only build about the smart contract, but also working with the hardware for making sure that your data is secured. Yeah.
That's great, Max. Thank you. That explains quite a lot. So you're going to have almost like a decentralized server network to hold the existing information, and then obviously the new stuff will be put on the blockchain. So thank you.
Yes. Thank you.
It's Leo, our CTO, not me.
Thank you, Lee. Very nice question. Let's see if we have Summer. Do you have a question? Summer?
Hello.
Hello. What is your question, please?
My question is about the accessibility of IVIRSE, since healthcare should be accessible to everyone. So, can anybody have access on IVIRSE's products? And is your project global?
Yes, our project is global. As you can see, and you can search for IVIRSE online. You see quite having a branding now in digital health and metaverse of healthcare. And if you want to get connected with the IVIRSE community, you can search for all the Telegram channels, and you can find it on Medium. You can find it on the Twitters, and you can find it on even Facebook and LinkedIn.
All right, thank you.
Thank you, Summer, for your question. Let's see. Muraba, do you have a question? Muraba.
Hello.
Hello?
Can I ask my question?
Yes, please.
In the website of the platform, I have read about the.
Now we can't hear you, Muraba.
Hello. Sorry, my
Hello?
my mic has a glitch.
Okay, try
So
again.
can I continue with my question?
Yes.
In the website of the platform, I have read about the DC Health platform, DC Health NFT. So can you give us more information on that? Because I came from non-crypto country. So is this platform is able to use in this country?
I'm sorry, when you mentioning non-crypto country, you mean crypto country is I mean,
is this only for crypto countries or non-crypto countries can use this platform?
So let me answer the questions, because like I guess that in the Indian, some kind of the law from government prevent maybe citizens to use some kind of the application for trading, right? Trading cryptocurrency. However, we built maybe the token wallets for users. So it means that you don't need to open to use the cryptocurrency trading like the Binance Smart Chain or something like the, maybe you don't need to have the DEX to buy our coin. We will provide a website for you, and we build the IVIRSE wallet for you. And with the IVIRSE wallet, you can access to the Binance Smart Chain, Ethereum, and the Solana. So in that case, you can use our applications. And so I don't know about the law in the Indian, because like for example, like if they just prevent people to trade the cryptocurrency, it is fine for using our applications. However, if the government prevent people to in some kind of the doing any actions related to the blockchain system, and I think that you cannot do anything because it is illegal. So please be careful about that. Yeah. Otherwise, yeah.
India is the most crypto is the most familiar, popular crypto country in the world. I mean, the adoption.
Thank you for the question answer, sir. Thank you so much.
Yeah, thank you, Muraba. I mean, crypto country, what is that really? I mean, you can always access crypto somehow, I guess. You can have a wallet on if you have a phone. But do you mean, Leo, or was it Max, that you can also buy the token eventually directly on your website with a credit card? And You don't really need a.
Yeah, that's true.
Yeah, okay.
We also build a gateway payment for people, so for user. So it means that you can buy. Yeah.
So you don't have to hold your token to use your services.
So if you want to use our services, you need to use our tokens.
Okay.
Yeah. However, we will provide more utilities for customer, for user. To, for example, for some time, if you don't have our tokens, you can buy it by using a credit card or some kind of the methods, and it will create the flexibility for maybe because we want to go global. So it means that we need to make it maybe easier for the user.
Yeah. Okay. Time flies, but can you guys stay for another question, or how does it look, your schedule?
Yeah, August. I think another question is fine.
Okay. Let's see what Alex has to ask today. Alex, do you have a question? I think we have a little of a glitch here. Alex, can you speak? Maybe not. Let's see what Captain Levi. Do you have a question, Captain?
Yeah, I actually have a question concerning the two separate tokens, the IVIE and the iHealth tokens. My first question is that can one be used to buy another? And I'm seeing they have separate use cases. So can one be used to buy another, or would they have to be, both of them have to be bought in order to be able to purchase and make them on this use case?
So for the IVI is like you can think the IVI like the BNB or ETH, and that is the like the cryptocurrency. And so, however, the IHI, that is the stable coin, and both of them can be maybe can convert to each other. And by using our system, we have created the exchange system for exchange from IVI to the IHI. It means that whenever you have the one kind of the token, you can convert to another. And so another thing is that both of them can be the things that, and you also can earn about the coin by using some kind of the applications inside our ecosystem, or something like you can try to invest in our system to get it. However, IHI is maybe will be created for user by using some kind of the rewarding mechanisms. For example, like if you in the future, in the next few months, we will release some kind of the game fee also, and we will create the game based on the blockchain system. Just make the people have the space to maybe to relax or something like that, and you can also get the reward IHI from that, and also you can get the IHI from maybe doing the transactions or something like spend any kind of the money inside the IVIRSE applications. Yeah.
Oh, I understand. Final question from my end. What requirements do the hospitals that you'll be partnering with? I see you've partnered with some other hospitals. So what requirements would these hospitals need to meet in order to be able to partner and invest or take part in your project?
So for the criteria for hospital to become our partner, for now, yes. So
Let me answer the
maybe
question.
Max will have. Okay.
Oh, hi, Captain. The criteria for the hospital to join our system is we have a rating system, and we have a public hospitals, and then we have a private hospital. We also have clinics and pharmacies, store trains. So it's a very sophisticated ranking system, but you can find it on our website isoftcare.com. And I'll be more than pleased to give you a copy of the criteria and the ranking system after this.
I really appreciate your answer. Thanks a lot, Mary, for the opportunity.
Mm-hmm.
Thank you, Captain. And thank you, everyone, for coming today and listening to this very interesting AMA. I hope you all go to their Telegram group and keep asking your questions, because this did not cover it all this hour, you know. I think there's a lot more to know about this great project. So I also hope you will come back, Max and Leo, to tell us more about this further on. You said you were going to launch in the fall, maybe?
Yeah, in fall.
Yeah.
Would be nice to follow you one more time, maybe in here. So I hope you come back.
We love the communities. It's been excellent question, and you've been a
great question,
Mary. Thank you
so much. I have a last question for you guys, and that's where do you see yourself in like 5 years' time? What's your long-term vision for this project?
So in the long terms, like in next 5, maybe for the next 4 years, we will create an ecosystem, and with the ecosystem, like we will build the blockchain system and also the machine learning algorithm, artificial intelligence, based on the data of user. And in that case, user can use any kind of the artificial intelligence with maybe with very, very small fee, just the transactions fee for user, and we do not cost about that. So that's why we want to bring the benefits to the community based on the data they contribute to the system, and it means that is the automated system. So you can get a lot of the applications from our ecosystem, and so I hope that you can bring benefits to other people in the community. And maybe in the far futures, we want to do some kind of the metaverse, and the blockchain will become the door. And as long as the patient and the customer, the user have the key to maybe to go over the door, then you can open another world in the virtual world, in the metaverse, and you can meet your doctor by using AR and VR.
Yes. Okay, Leo. In short, we're seeing ourselves in the top 100 coin market cap in 3 years, and in 5 years in the top platform coin projects. I mean crypto projects. That is our goal, and what we see ourselves in the next 5 years, because we believe in healthcare and we believe in these projects.
Nice, very nice, guys. Thank you so much for coming, and I wish you all the best and good luck, and hope lots of us in here follow you on your Twitter accounts. Not Twitter, that too, but Telegram. I mean,
exactly.
Yes.
So
yes.
Hope
Thank
to
you,
see
Mary.
you around
Thank
soon,
you.
and thank you so much, guys. It was a pleasure.
Thank you, Mary. Thank you, every participants in this group. And I think that I received a lot of the interesting questions today. So if you have any feedbacks or something like the contributions for us, I am very appreciative with that, because I am doing the things like create the applications for you. So yes, so I'm willing to have any questions and any contributions to us to improve our system in the future. Yeah, again, thank you so much.
Nice, thank you. I will stop the recording now. So have a good wherever you are, guys.
See you.